digital transformation is kind of a buzzword right now, as we all know, but in healthcare it is a kind of a bigger buzzword. And the definition of digital transformation depends on healthcare to healthcare, as Niranjan mentioned. It depends on the type of hospitals, the mindset of the CIOs, the mindset of the management of the healthcare groups. So there are various factors which really defines the requirement of the digital transformation within the healthcare industry I'm talking about. If we start, let's say 2 decades back, so digital transformation in healthcare was kind of a automation of the back office functionality, which includes like appointments, the billing, managing of the TPAs, managing of the doctors' clinics, those kind of things. Most of the hospitals, they achieved that, and then they thought, what is next? Next is the functions which are not the core clinical function, but which are the very integral function within the hospital, like doctors' clinics, like OTs, like CSSD, like housekeeping, like ERP, like finance, and after inventory. So then hospital started putting their efforts, and then they ensured that, okay, our medical workflows are intact, but on top of that, we need to integrate those functionalities so that my overall hospital workflows are automated, and they are giving me a kind of a consolidated insights in terms of the business. There was still at that point of time less emphasis in terms of the electronic medical records, in terms of the health information exchange, in terms of the clinical decision system. But in last 4 to 5 years, we saw a kind of a shift from most of the hospitals, because they have achieved the layer 1 and layer 2 of the automation. Then they thought of, let's do something which is a kind of a core healthcare driven, means deploying healthcare systems which is contributing to the core healthcare delivery. Then the concept of EMR, the concept of electronic health records, the concept of health information exchange, where the health information is contributed by the doctors, is contributed by the nurses, and is contributed by the patient itself, started. And then on top of that, more system like Niranjan just mentioned, that NLP based device algorithm like CDSS, clinical decision support systems, for the various type of the specialty of the clinical delivery ecosystem. So those kind of system they evolved. So I think my suggestion or my advice is, the era which is right now going on is the era post-COVID, is where we need to ensure that how we can provide the healthcare with the minimum disruption and with the ease of the healthcare delivery services to the patient, so that the patient ultimately, who is a key stakeholder of the healthcare delivery ecosystem, should feel that the transaction within the healthcare is very easy. And on top of that, my second stakeholder is the clinician. So I need to provide them the toolkit, so that whatever toolkit is required for them to take a right clinical decision support, that should be available to them. And the third thing is, now the hospital needs to start thinking that whatever the framework which government is deploying, that is very important, because government is deploying so many frameworks. They are deploying ABHA, Ayushman Bharat Health Account System. They are deploying a kind of a ecosystem to exchange the health information, right? HIE. So, and government is spending a lot of money, and ultimately they want to have a patient in a position so that my health records can be exchanged from a healthcare provider A to healthcare provider B. And also my health records should be available in my reach, so that if I am the patient, I should have all the health records in the form of PHR from the various healthcare delivery partners. So I think hospital needs to be now in coming years, hospital needs to be very, very aggressive in terms of adopting those technologies, because ultimately whatever technologies we talked about, like telemedicine, teleconsult, these kind of technologies would only be available once we have the service delivery or the service discovery mechanism. So the upcoming UHI, which we call the Unified Health Interface, that is a kind of a layer, a kind of a box which government is deploying. And if my systems are not connectable or not interoperable to that layer, so I would be in isolation. So I would be good in terms of my organization for the back office automation, for for the making happy to my own patient and my own doctors, but I would not be able to connect to the bigger system. So my hospital would miss the discoveries of the services which I am providing. So I think in coming years, the most of the CIOs, the most of the healthcare organization, they need to think seriously that how they can contribute to that, and so that the overall health digital health ecosystem of the country is successful.